Guys, in the last video we were looking at the etiological classification of diabetes mellitus. We started off with it. We saw details on type 1 diabetes mellitus, where there is insulin deficiency. So it is insulin dependent diabetes mellitus. It can be of two types, autoimmune or immune mediated, you can say, immune mediated, and you can have idiopathic. Okay. So is this clear? So now we will move on to type 2 diabetes mellitus. Is the most common. We are not going into very details. We're just looking at the classification. Here what happens, this is very common, like I told you, it's a very common case of diabetes mellitus. And it was earlier called as maturity onset diabetes. But now this term is not used because it can occur even in obese children. Okay. And earlier it was also called as non-insulin dependent diabetes mellitus. Interestingly, this term is obsolete too. Only type 1, type 2 is actual terms. This insulin dependent and non-insulin dependent is not the correct terminology they are saying, because this person is non-insulin dependent, but actually what therapy is given is insulin itself. Okay. So it is not a true case of non-insulin dependent diabetes mellitus. Okay. So major risk factors for type 2 diabetes mellitus you should know, because this type 2 diabetes mellitus is the most common, and we should know the risk factors. I'll bring it in one second. So you need to understand why this type of diabetes mellitus occurs. It is because of family history of type 2 diabetes mellitus, obesity. We mentioned, obesity even in children can lead to type 2 diabetes mellitus. Hence, this has nothing to do with maturity onset. It can happen in any age. Habitual physical inactivity. If there's physical inactivity, obviously person will go to obesity probably. And diabetes mellitus. Race and ethnicity. Blacks, Asians, Pacific Islanders. Asians, you can remember us, Indians, and hence we can say type 2 diabetes mellitus more in our race, ethnicity. Previous identification of impaired fasting glucose or impaired glucose tolerance. So previously itself they have some glucose intolerance, impaired glucose tolerance. History of gestational diabetes mellitus, delivery of baby heavier than 4 kgs, hypertension. All these are metabolic syndromes. Remember, we have already covered this obesity, hypertension in metabolic syndromes. Then you have dyslipidemia, that is HDL is less and triglycerides are more. Polycystic ovary disease, acanthosis nigricans, history of vascular disease. Let's just look at the details. What is this acanthosis nigricans? Skin condition characterized by areas of dark velvety discoloration in body folds and creases. In the body folds and creases, if there is dark velvety discoloration, it is called as acanthosis nigricans. Fine, all these are metabolic syndromes. They can lead to type 2 diabetes mellitus. What and all you can remember here? Family history, obesity, hypertension, dyslipidemia, history of gestational diabetes, and in Asians it will be more. Physical inactivity, obviously, obesity. Fine. So as of now in etiological classification, this much information is enough. Then we will go into details later. Okay. Now let us move on to other specific types of diabetes. I think it is better to make a separate video. What you say? Okay. So come back and we will continue other specific types of diabetes. Okay.